Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of platelet-rich plasma therapy. It's a very exciting procedure. It uses one's own growth factors, platelets, and stem cells to regenerate damaged tissue. It's also known as PRP therapy. It's been previously used in dentistry, urology, ophthalmology, and quite a few other fields, but recently it's become very popular in the musculoskeletal realm. The definition of PRP is a volume of plasma that has a platelet count above the baseline of whole blood. Regenerative medicine breaks the mold of conventional treatments. When you start talking about cortisone, it's a steroid medication that works well when you inject it, but it doesn't regenerate or fix anything. Traditional treatments offer a proverbial band-aid, whereas when you start talking about regenerative treatments, you're actually helping to heal the problem itself. So what are the indications for PRP therapy? Tennis elbow, golfer's elbow, which is tendinitis, rotator cuff tears, other types of tendinitis such as Achilles or knee, arthritis, such as in the knee, the shoulder, the hip, etc., and ligament injuries. So this could either be from a sports injury, a trauma, and then also good old degenerative arthritis. Athletes are using PRP like crazy. It's been approved by all the major professional sports leagues. Athletes such as Rafael Nadal, Tiger Woods, Kobe Bryant, several players on the Dodgers. The list really does go on and on. How is PRP performed? Well, initially it involves a blood draw, and this is a simple blood draw just like you would get at the lab. About 30 to 60 cc's is then placed in a centrifuge, which spins it very fast for about 15 minutes, and that turns it into 3 layers. The top layer is a platelet-poor plasma, the middle layer is a platelet-rich plasma, and the bottom is red blood cells. So the middle layer is what's used, and that's what's then injected into the area of need, and it ends up being around 5 to 10 cc's when you start with 30 to 60. PRP therapy actually promotes inflammation, which is the first phase of healing. Therefore, patients should not take anti-inflammatories prior to treatment. As mentioned, professional sports leagues have not banned the use of PRP therapy. Initially, the World Anti-Doping Association did ban it, but as of 2011, it is accepted. They said lack of any current evidence concerning the use of these methods for purposes of performance enhancement. So it really is more just for healing and regeneration and repair as opposed to performance enhancement. What are the outcomes? Well, more and more studies are coming out. A knee study of 22 patients recently showed no change in arthritis in over 80% at 1 year with just 1 injection. So it didn't get any worse. Pain scores significantly decreased, whereas functional and clinical scores increased at 6 months and 1 year from baseline. Most patients do end up getting more than 1 injection, so the fact that with only 1 injection this procedure works so well is remarkable. Basic science studies show that PRP treatment may improve healing in many tissues. Large clinical studies in humans do not exist yet. Another study out of South Florida looked at PRP therapy for tennis elbow in 30 patients who had tried everything. These patients basically were just waiting for surgery, looking for something else, and over 90% of them were able to avoid the need for an operation with PRP therapy. More studies are needed to prove the effectiveness of PRP and to research the best ways to standardize the treatment's preparation. It's the patient's own blood. It's an outpatient procedure. You do have increased pain for about 48 hours, and then it dissipates. It's usually a series of 2 to 3 injections. It's not covered by insurance currently, and studies, as mentioned, are showing excellent outcomes with slight downside, very minor risk of infection. The risks are so low and the benefits can be so high that the risk-benefit ratio is definitely worth taking a look at it. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. As mentioned, PRP therapy is not currently covered by insurance. The board-certified award-winning doctors offer all these treatments and the average success rate exceeds 90%. Visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.